Hi, my name is Maria Bourjoli. This week, the patient present with lower back pain. And the differential diagnostic for this week are S1 radiculopathy due to degeneration or disc herniation, L5S1 disc herniation, or L5 neuropathy, which is disease of the nerve. To begin with, we are going to start with inspection. And for inspection, I'm going to have the patient stand up for me. And when I have the patient stand up for me, I'm going to be observing for minor sign. So if I can have you stand up for me. Okay, so I'm basically looking to see if the patient needed any support as he stood up. So the next thing I'm going to have you do, I'm going to have you walk. You could walk either this way or that way for me. I'm going to have him walk back and forth. Okay, so what I'm observing for is to see when the patient is walking, if he can move on his own or if he needs assistance while he's walking. I'm also observing for the quality of the movement and posture, and I'm also gonna be checking in. So the next thing I'm gonna have you do, I'm gonna have you sit but face the wall for me, please. Okay, so the next thing I'm gonna have the patient do while he sit down, I'm gonna be moving on to basically observing. So is it okay if I make contact with your back and untie your gown?
Yes.
All right. So here I am observing I'm looking for any scars, any lesion, any asymmetry, any hair patches. I'm also just looking for any discoloration of the skin. Okay, and that will conclude my inspection. I'm now going to be performing the lumbar range of motion. For that one, I'm going to be stabilizing right at the patient iliac crest. So what I'm going to have you do, I'm going to have you bend forward for me. Come back up. That will be flexion at 25. So I'm going to step to the side and I'm going to have you lean backward for me. Come back up. There'll be an extension at 30. So now I'm gonna have you look to your shoulder for me. Turn this way. That'll be rotation, and I'm gonna have you do it on the opposite side. Rotation at 30, and I'm not gonna have you do lateral flexion for me. So I'm gonna have you take your hand, slide it down to your side. This way. Come back up. I'm gonna have you do the other one. All right, that'll be lateral flexion at 25. Next, I'm going to be moving to bony palpation of the lumbar. So first thing first, I'm going to have my patient lay face down for me. Okay, is it okay if I untop your gown?
Yes.
All right, to begin the bony palpation of the lumbar, I'm gonna start with palpating the spinuses. So I can start right here, palpating right on the spinous process of the lumbar. And then next, I'm gonna move on to the sacrotubercles. I'm gonna be palpating S1, S2. Okay, from the sacrotubercle, I'm going to also be palpating the iliac crest. So I'm going to be palpating the crest right here. All right, I'll palpate the top of the crest. And then the next one I'm going to be doing is palpating the PSIs. So right here we have his PSIs. We're going to be palpating them. And that completes the bony palpation of the lumbar. I'm now going to move on to soft tissue palpation of the lumbar. To begin, I'm gonna have my patient lay flat down for me. Lay face down. Come on. Alright, I'm gonna untuck your gown. Alright, to begin with, I'm going to do the paraspinal muscles and I'm gonna do them as a group. And to do that, I'm gonna be coming here. I'm now gonna move on to spinalis. So I'm gonna go here, so the spinous fascias are right in the middle. I'm gonna come slightly lateral, and I'm gonna palpate that going down. Alright, and I'm gonna do that on both sides. This will be spinalis. Okay, I'm gonna come slightly lateral from the spinalis to palpate the longissimus muscle, and I'm also gonna be palpating that individually. So come in here, spinalis and longissimus. Going down, going to palpate it going down as well. I'm now going to palpate the iliocostalis. I'm now going to move to the sciatic nerve. To do that, I'm going to make a fist. I'm going to go down to the ischiotubulosity, which is right here, and I'm going to find the greater trochanter. And then, so I'm going to take my hand and place it right there. I'm going to come slightly lateral. So I believe the sciatic nerve is right here. So I'm going to palpate that with my tongue. And I'm going to do that bilaterally. Same over here, I'm going to find the ischiotubulosity. I'm sorry, I should be asking for permission. Is it okay if I touch your buttocks area?
Yes.
All right, I'm going to make a fist. Here, I'm gonna find the greater trochanter. Here, and I'm going to be placing my hand right at the ischiotube, and when I come slightly lateral between the ischiotube and the greater trochanter, find the sciatic nerve, and I'm going to use my tongue to palpate that. I'm now going to palpate the gluteus maximus. I'm gonna palpate this, go in the S motion. Okay, I'm now going to move on to the gluteus medius, and to do that, we're gonna start skin on skin. And I'm gonna palpate all the way to the greater trochanter, which is about right there. I'm now going to palpate the hamstring muscles as a group, starting at the ischiotube. Now we'll be palpating the hamstring muscle individually, starting with the bicep femoris, going back to the ischiotube here, and I'm going to be palpating for bicep femoris. I'm now going back to the ischiotube as well, and I'm going to be palpating for the semi-membranosus, which is the most medial. Going back to the ischiotube, I'm going to now palpating for semi-tendinosus, which is going down here, all the way down to the pes instator. I'm now going to palpate for the interior abdominal muscles. To do that, I'm going to have my patient turn around and lay face up for me. So if I can have you come up and turn to your back. With your face up, lifting your gown, and access to your tongue. Alright, So this will be me palpating for the interior abdominal muscles. Okay, this will complete my soft tissue palpation. I'm now going to move on to the ortho exam of the lumbar. To begin with, we're going to start with a straight leg raise. So I'm going to start with this side. I'm going to be stabilizing right above the knee and underneath the ankle. I'm going to be bringing the patient's leg slowly up to 90 degrees. Do you feel pain?
A little right here.
Okay. All right, I'm gonna try that bilaterally since the patient may have experienced some pain here. I'm going to do that. Do you feel pain?
Oh.
Okay. Okay. A positive will be radiating pain, or dull posterior type pain, which would indicate if the patient experienced pain between 35 and 70 degree, it would be sciatic radiculopathy, or if the patient experiencing pain that is 70 and above, that would mean that the patient have tight hamstring. So next I'm gonna be moving to Bogard test. All right, so to begin with, I'm going to start with the patient affected leg. I'm going to raise that to the point of pain. All right, I'm gonna drop down back to 15. And so now I'm going to dorsiflex the foot. All right, a positive will be radiating pain, although posterior type pain, which will indicate sciatic radiculopathy. I'm now going to move to the well leg raise test. For that test, let's say if we assume the patient have less sciatic pain, I'm going to be raising the opposite leg. In this case, my patient did express some tight hamstring on the left one, so I'm going to raise the opposite leg. All right. Positive of this test will be pain in the affected leg, or reduced pain in the affected leg. So basically say when I raise the, if the patient experiencing pain or increased pain in the affected leg, it will indicate a medial disc bulge, or a patient experiencing reduced or decreased pain in the affected leg, it will indicate a lateral disc bulge. The next exam is going to be a bowstring test sign. For this one, I'm going to have the patient stand up for me. Slightly come over. I'm going to be opening the gown. I'm going to be observing the paraspinal muscles. So I'm going to have you bend to the left for me. Come back. I'm going to have you bend to the right for me. All right. A positive of this exam would be ipsilateral tightening and contraction of the paraspinal musculatures, which would indicate a ankylosing spondylitis. All right, the next test is gonna be Kemp test. For the Kemp test, I'm gonna have you cross your arm for me. I'm gonna reach around you. I'm gonna be placing my hand on the opposite PSIS, and I'm going to laterally bend the patient and turn them that way. All right, I'm gonna do the opposite side, cross around you, place hand, turn you. Now the positive for the Kemp test would be pain, usually radicular or recreating existing sciatic pain, indicating disc lesion. It will be medial disc lesion when pain elicit when the patient leans away from the affected side, or it will be lateral disc lesion if pain elicit when the patient leans toward the affected side. The second one would be local pain, which would indicate facet capsulitis or lumbar muscle spasm. Okay. All right. So next we're gonna move to the motor test S1. We're gonna start with the foot plantar flexion. For the foot plantar flexion, I'm gonna have you bring your feet up for me. Now I'm gonna have you put your toe down. I'm going to try to bring it up. Don't let me. That will be foot plantar flexion. Testing for gastrocnemius and soleus, which innervated by the tibial nerve. Okay, so the next one is going to be plantar flexion eversion. So I'm going to have the patient bring his leg up. I'm going to have you point your toe down and out, stabilizing above here. I'm going to try to bring it up and in. Don't let me. Foot plantar flexion eversion, testing for fibular longus and brevis, which is innervated by the superficial fibular nerve. Okay, the next exam is going to be hip extension. First, I'm going to have you bend your knees for me. So then I'm going to have you lift up your thighs at the table, from the table. I'm going to be pressing down. Please don't let me. Okay, good, relax. This was hip extension, testing for gluteus maximus muscle, which innervated by the inferior gluteal ligament. So next we're gonna move on to reflexes, S1 reflexes. This is gonna be my reflex hammer. Are you patient?
Yep.
This is my reflex hammer, which feels just like so.
Good.
Okay. All right. So I'm gonna have you bend your knees for me. Dorsiflex the feet. No, testing for reflex. We're gonna do the same thing over here. And dorsiflex the knee, feet. This would be Achilles reflex. We're now going to be moving to the sensory portion of the lumbars. This is my neurological pinwheel patient. Okay. And it feels like this.
Okay.
Is that okay? All right, relax for me. All right. L5. Can you feel this?
Yes.
Does it feels like this?
Yes.
Okay. Can you feel this?
Yes.
Does it feels like this?
Yes.
Can you feel this?
Yes.
Does it feel like this?
Yes.
All right, now we're gonna be testing it individually. L5, can you feel this?
Yes.
Does it feels like this?
Yes.
Can you feel this?
Yes.
Does it feels like this?
Yes.
All right. Can you feel this?
Yes.
Does it feels like this?
Yes.
Can you feel this?
Yes.
Does it feels like this?
Yes.
That will conclude this.